Sexual health is a state of physical, mental, and social well-being in relation to sexuality. It requires positive and respectful approach to sexuality and sexual relationship. Good afternoon, everyone.
Welcome, sir. Sir.
Thanks, sir. First of all, I would like to thank all my teachers, Dr. Rao sir, Dr. Nilima madam, Dr. Raj Brahmat sir, Dr. Sharad sir, and all those people who have taught me. I've done my fellowship under Dr. T.S.S. Rao, and I am thankful to them.
Sir.
I'll start my presentation. Today's topic is importance of sleep and food to optimize healthy sexual relationship. What is healthy mind and body? To begin with, it involves the physical health, the mental health, and the sexual health to be in the optimum state of functioning. Wow. How we can optimize the physical health? That is the exercise regularly, eat balanced diet, get enough sleep, stay hydrated, maintain regular medical checkups. In the mental health, we have to manage our stress, treat the stress and related factors, creating and precipitating it, build emotional intimacy, practice self-acceptance, seek professional help if needed. The third part is the sexual health, which concerns all of us. Communicate openly with your partner, educate yourself about sexual health, and practice safe sex and explore mutual desires. What are the basics of sexual health? Sexual health is a state of physical, mental, and social well-being in relation to sexuality. It requires positive and respectful approach to sexuality and sexual relationship. Reproductive health implies that people are able to have responsible, satisfying, and safer sex life, and that they have the capacity to reproduce and freedom to decide if and when and how often to do so. The definition according to the current working definition would be of the sexual health is a state of physical, mental, emotional, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual relation, we have to strike a balance between all the factors related to the sexual functioning. So how do we do that? The basics include emotional, psychological, physical, intellectual, and spiritual dimension, along with involvement of certain characteristics for an healthy balance. The first one is communication part, where we have to open our talks, we have to be divulging our thoughts and the process of the thoughts, and we have to have a respectful communication. We have to put in a lot of effort and maintain the relationship dynamics. We have to have a healthy relationship. And how do we do that? That is being responsible, trustworthy relationship between the partners that we have to maintain. We have to also maintain the self-worth and esteem. Being open to sexual feeling, pleasures, and with their partners and accepting the way they are. The next one is values. Having the right values and the respect for each other. Right values means to consider the other person's viewpoints and also function your own. We have to function on our own in the viewpoint that we have to have values which guide us throughout to maintain the relationship. Spirituality. Understanding of sexual union is a way of connecting heart, mind, body, and soul. What makes a healthy sexual relationship? The one who has emotionally fulfilled relationship, satisfied relationship, respected relationship. There should be equality among the sexes and the partners. There should be a fairness amongst both of the partners. There should be a lot of positivity which can in turn bring in a lot of healthy changes and optimize the sexual balance. Love and trust should be worked upon, and if not, then it should be cultivated and should be increased so that the relationship is maintained and increased. These are the few factors which we already are aware about. These are sexual orientation, sexual self, and sexual and self-concept, components of sexual health, body image, and gender identity. These are the factors we have to deal with while maintaining the sexual balance, and in relation to the partner, we have to optimize the sexual relationship. The first topic is about the food and sexual relationship. Nutrition and its importance. What is the importance? Primarily, the hormonal balance that we should be aware about. Proper nutrition supports the production and regulation of hormones that are vital for sexual health. For example, nutrients like zinc and vitamin D are essential for testosterone production in men and women, both of which are very crucial for the libido and sexual function. The next one is circulatory health. A diet rich in antioxidants, healthy fats, and vitamins can improve the blood flow and the cardiovascular health. This is an importance for sexual function because good circulation helps in achieving and maintaining erections in men and the arousal part in female. The next is energy levels through nutrition. Consuming a balanced diet provides the energy needed for the physical activity and overall vitality. Adequate energy levels can enhance sexual desire and stamina, making it easier to engage in and enjoy the sexual activity. Reproductive health. Certain nutrients are essential for reproductive health. For example, folic acid is crucial for cell division and reproductive health, while antioxidants like vitamin C and E help protect the reproductive cells from damage. A well-rounded diet can support fertility and overall reproductive function. Further on, stressing upon the importance of food and nutrients in the healthy sexual relationship, what does the nutrient supply do? A balanced diet would provide the necessary nutrients that are supporting the overall bodily functions, including the sexual health. What does blood flow do? Some foods that can improve the blood circulation, which is essential for sexual arousal and performance. Hormonal balance, as I previously said, certain foods contain nutrients that help regulate hormones related to sexual health. The next is energy and stamina, which again I had covered up. A well-rounded diet ensures that you have the energy and the stamina required for a fulfilling sex life. What are the conditions that can be a hindrance and a hurdle in performing the sexual relationship or have a good sexual performance? Some things which we should know which prevent sexual good health is obesity, poor nutrition, high sugar intake, alcohol and substance abuse. Excessive weight in obesity can lead to hormonal imbalances and reduced libido. Poor nutrition, a diet lacking in essential nutrients can affect the overall health and sexual function. Third is the high sugar intake, primarily found in diabetics, would definitely lead to diabetes, which can cause sexual dysfunction. Alcohol and substance abuse. This can also impair the sexual performance and desire. Now, having known what should not be taken and what care to be taken, we need to know what can boost up the sexual health. These are few of the food items which we should be preferring in case there is an increase in the sexual performance which is desirable. Fish, nuts and seeds, fruits, dark chocolate, eggs, berries, garlic and beans and yogurts are certain foods which can boost up the sexual health. And again, in addition to that, certain other components of the food that are iron, magnesium, antioxidants, omega-3 fatty acids, vitamin D, zinc are these some of the items which can add up to the boosting of the sexual performance. I'll cover up each in details. Zinc would be supporting testosterone production and immune function found in seafood, red meat, nuts and seeds. And I've shown the pictures of certain products which can be imparting very high levels of zinc in the regular nutrition. Vitamin D. This aids in hormone regulation and improves mood, obtained from sunlight, fatty fish, and fortified food. Again, there are certain items which are mentioned there. One can always, in their daily routine life, can add up to the nutrition. Omega-3 fatty acids. promote healthy blood flow, and reduce inflammation in the arteries, which is found in fish, flax seeds, and walnuts. Antioxidants. These are the substances which protect the reproductive cells from oxidative damage and support healthy blood flow. Found in fruits, vegetables, nuts, and seeds, mostly present in vitamin C and E. Magnesium, an important component, but generally we have missed all this most of the times, and we don't pay attention to the food item which imparts magnesium in our food. In turn, we should eat more of almonds, spinach, avocados, potatoes, etc. Iron. Is it vital and very essential for energy levels and overall vitality? Found in red meat, legumes, and fortified cereals. Foods that enhance libido does have oysters, chocolate, and avocados as a content. Now we should also know what foods to avoid which can harm sexual health. The processed foods and high sugar intake, excessive alcohol and caffeine, and impact of trans fat. Important aspect of maintaining the good sexual performance is role of hydration. Proper hydration ensures all organs, including those that involved in sexual function, to be working optimally. Hydration affects the blood volume and circulation, which are critical of sexual arousal and performance. Adequate hydration is necessary for natural lubrication and especially in women. What does dehydration do or lack of hydration would do? It can impair the sexual performance. Dehydration lead to reduced blood flow, impact sexual functioning in both men and women. Dehydration can lead to reduced blood flow, impacting sexual desire as well. Dehydration can lead to vaginal dryness, causing discomfort or pain during the sex. Symptoms of dehydration, how will we identify clinically? They would be fatigue, headache, dizziness, and all these symptoms would indirectly contribute to lowering the libido and sexual energy. Impact on mood. Dehydration can affect mood, leading to irritability and stress, which negatively impacts sexual desire. Coming back to the important part of sleep and sexual performance. The relationship between sleep and sexual health is important from the point of view of to maintain the normalcy of the sexual performance. We need to know that sleep is essential for body's recovery, energy restoration, and mental clarity. It regulates hormone levels, including those critical for sexual function. The next is adequate sleep also supports emotional balance, stress management, and overall mood. What does sleep deprivation do, and how does it affect? It affects directly on the sexual performance. It reduces libido and also lead to sexual dysfunction. Erectile dysfunction it can create. Poor sleep is linked to erectile dysfunction in men and also decreased blood flow and hormonal imbalances in both the sexes. What is the impact on this? Lack of sleep can lead to irritability, stress, negatively impacting intimacy and relationship satisfaction. Now, role of sleep disorders in sexual health. What are the common sleep disorders that we encounter? These are commonly called as insomnia, which is difficulty in falling or staying asleep, which is directly associated with decreased sexual satisfaction. Sleep apnea is a condition wherein breathing repeatedly stops and stops during the sleep, linked to reduced testosterone levels and erectile dysfunction. Impact on sexual health would be that it would be again adding to the hormonal balances and energy levels, affecting sexual performance and desire. These are again the repetition of the previous slide, so I'll skip this. What are the benefits of good sleep and sexual health? This would definitely enhance the libido. The sleep quality, which if whenever improved or optimized, leads to increased sexual desire and arousal. Improved sexual function. Regular restful sleep supports physical readiness for sexual activity, strengthen relationships. Good sleep fosters emotional well-being, leading to healthier and more satisfying relationships. How do we do that? We have to improve the sleeping habits, starting from avoiding what we should not be doing. We have to avoid caffeine, alcohol, nicotine before the bedtime or few hours before the bedtime. Generally, 6 p.m. is the usual standard time which is being told in the office goers who are very hard pressed for the time and also working on with the home kind of a setup where they have to work from home. They keep on drinking caffeine, a lot of caffeine and nicotine. So they generally fall into this kind of a situation which is detrimental to their healthy sexual relationships. Keeping a regular sleep schedule, follow a relaxing bedtime habits, then avoiding eating and drinking before the bedtime in the last few hours, reducing the use of electronic gadgets as social media is rampant nowadays. So we all are bombarded with all these compulsions of the today's modern life. So we have to avoid that. Then we have to avoid naps in the daytime. Again, go for a favorable temperature of the room if possible, practically, and you should have a comfortable and a silent and dark room to have your regular nighttime sleep. These are the factors which we have to look and care for to improve the sleeping habits. These are some more tips that we have to go to the bed at a regular time, wake up at the same time every day. As we know, the brain has a diurnal function being managed by the brain. We have to create a sleep-friendly environment, keep the bedroom dark, cool, and quiet, avoid stimulants, caffeine, alcohol, nicotine, and also deal with the stressful events and conditions wherein you can practice relaxation techniques to avoid the stress and practice meditation or deep breathing to improve the sleep quality. I'll show you a video here, which will be throwing some light on this. Excuse me. It's not playing. This again, sleep, sex, and hormonal balance. What does estrogen do? Which is, or how important the role is. It is vital for sexual arousal and vaginal lubrication in women. Sleep disturbances can lower estrogen levels, leading to decreased libido. Testosterone, which is very crucial for sexual drive in both men and women. Testosterone levels increase during sleep and are the highest in the morning. Coming to melatonin, which is the natural content in the body, but which can be added upon our treatment aspects from the pharmacological aspects and also given to optimize and improve the sleep quality. What does it do? It regulates the sleep-wake cycle, influences the hormonal balance, supports libido, and there are antioxidant properties in melatonin, regulates reproductive hormones, influence on the seasonal reproduction. It reduces the stress and anxiety, improves the erectile function, supports fertility, influence on sexual maturation also is known in case of melatonin addition. And coming to the second last slide, these are a few of the strategies to improve access to sexual and reproductive health services. Like we can provide contraception on campus sexually transmitted disease screening. There should be condom availability programs in the campuses and colleges and wherever it can be done. Online contraception providers, mobile healthcare clinics should be set up wherein they can also psychoeducate the people about the safe sexual practices. Telehealth services are now started in some areas of the country wherein they promote psychoeducation related to sexual practices. And also school clinic partnerships wherein they bring in the awareness about the psychological aspects as well as the sexual aspects in the teenagers and people who are vulnerable to fall into this kind of a problem. Thank you so much.
Thank you, sir. Sir had explained in detail all these things. Now the session is open for question. Any questions?
Any questions?
You said that afternoon nap is not that good for sex. Is there any study on that? Or because some recommend an evening nap between 4 and
Hello,
5 is quite good. So what's your
myself
opinion
Dr.
about
Gyanand
it?
Kumar. I am psychiatrist, professor in medical college in Ayodhya. My question is, you have said, I am agree with you, alcohol should be avoided for this, for the
Caffeine.
caffeine and alcohol should be avoided.
Yes.
But many person came to us in OPD, sir, alcohol ना लो तो मूड ही नहीं बनता है.
Yes.
So first is how, how many packs should person we will prescribe or suggest to person after that before sex how much alcohol you have to take it. Second question is how many times or how many hours after the dinner person should perform the sex.
Regarding the first question, when a layman is asking you whether how much alcohol to have, whether it should be, one should be consuming the alcohol or not, we should, as a medical people and doctors, we should bring in awareness in their, in them that actually it works in both ways. When it takes away the anxiety part and relaxes the mind, after crossing a certain limit, it does weaken up the performance part. And nobody knows that the barrier and the breakthrough level of each person, because that varies from person to person. But what we can do is, there is a way when we have to optimize the sexual relationship. One has to avoid it. You never know how much the barrier would be, when the barrier would be crossed, and what is the barrier for each individual person. Right?
I have gone the one.
Okay, sir. We can discuss later in tea time because we are running short of time. So thank you so much for the
Thank you
session,
so much for
sir.
your patient listening.
I request felicitation of Dr. Paresh C Trivedi by our chairperson. Thank you so much.